Okay, so thanks everyone for joining us. So what the format of the session today will be more conversational. For those of you that have seen our previous webinars on things like agile and squad working, on homeschooling, and leading virtual teams, you will know the format of the session, which is more conversational, because I think we get a lot more depth when we have a conversation about a particular topic. So I'm going to welcome Mel. Mel, tell us a little bit about your background, please, and sort of where your interest in mental health in the workplace came from, and we can start there.
Good morning, everybody. Hope everybody's safe and well. Good morning, Cash. Yeah, my interest in this goes back about 35 years ago, Cash. I was only 12, by the way. Yeah. And I'd just been appointed director of a large organisation. I'd just finished my MBA, and I think in those halcyon days I thought I knew everything. And three cases come to mind that proved and provoked me with a lifelong obsession about health and well-being in the world. The first case was a woman who lost a baby, and nobody knew in the organisation how to deal with this. Yeah? And it left me feeling incredibly vulnerable, quite frankly incompetent and ashamed about how to deal with it. Nobody knew. And what she was suffering from was quite simply grief. Second case was a senior manager I worked with, probably the most innovative, talented, driven person I ever came across in my working life. His ideas with Cash were incredibly revolutionary for the time, but nobody would buy in. Nobody would buy into his ideas. And when I assessed in those days, well, probably since, not those days, what he lacked was empathy, trust, feeling, incredibly egocentric, self-centered individual. Eat your heart out, Donald Trump. Yeah, and probably had a personality disorder, a narcissistic personality disorder. I don't know who tells him that, mind. The third case was a woman we worked with whose husband committed suicide. And she had two young children, had to balance work and life commitments, and yet again, nobody knew what to do. And I did know a husband. I'd met him in a few places before, and so many questions that came to mind, not only for the woman, but could I have minimized the possibility, which we all have those issues when somebody takes a life? And I later counselled the woman and found that that created for me a lifelong, quite macabre maybe, lifelong fascination with suicide and its effect on people. Following this, I did a degree in counselling psychology and specialised in stress, and as probably some people know, in conflict resolution mediation. And I guess, Cash, my summary of this, after 35 years, the more I know, the less I realise I do know. So for me, it seems I have a lifelong obsession with misery and conflict, Cash. Yeah?
Okay. Stands you in good stead, I guess. And I think there is something about how we sort of help our colleagues and learn from some of your experiences. And certainly I can reflect on my experience. I used to be a head of OD in a big mental health trust in Greater Manchester, and there is a what they call it equality of esteem, if you like. So it's the mental health is getting the same level of attention now as physical health would. So, for example, you can see somebody that's got a broken arm, for example. So there is something about actually acknowledging the presence of mental health more than it used to be in the past. There's less stigma attached to it, I think. But I think looking at the slide that's on the spot at the moment, how do you go about defining mental health in the workplace? What's your sort of personal definition of it, Mel? So how do you talk about that?
I think lots of people, I think we have to be very careful. Lots of people, I'm sure everybody on the webinar would agree, lots of people with mental health problems handle life incredibly successful, but many people don't. I think lots of people, there's the stigma, apparent lack of support, and in many cases a lack of recognition. Others know, but they don't. But I also believe one of the important things, Cash, is that we define things in solution format rather than problem format. And I think the World Health Organization, which is getting quite a little bit of unnecessarily press at the moment, define mental health as a state of well-being in which every individual realizes their own potential and can cope with the normal stresses of life, can work productively and fruitfully, and is able to make a contribution towards their own community. So for me, everybody is unique. And I think we need to look at defining mental health, not just from a humanistic point of view, but from an economic perspective. And like you just said, Cash, a broken heart can take longer than a broken arm to heal. And there's so many, it's such a wide subject. There's personality disorders, mood disorders, depression, anxiety, and each of those have personal and productivity issues. And I think that workplaces that promote effective mental health are likely to reduce absenteeism, turnover. I think there's obviously going to be an increase in productivity. And as I've said to many people before, just things like personality clashes in the workplace, which is not necessarily a mental health issue. One organisation estimated that an investigation, for instance, can cost about £32,000. Surely there's better ways. And yet again, the World Health Organization say that for £1 invested, there's a £4 return. I think we need to look at it in what people can do rather than what the problem is, Cash.
Yeah, and I think just looking at the slide that's on, we've got a couple of infographics that we would like to share. So one is around 10 things every employer should. And I know that we've got people on the call who've got various support packages in place for well-being and mental health, and this session is about how you can bolster some of that with some of the support we're going to be suggesting later on. And then the main one is from Public Health England on how you can support mental health. Well, it's a spotlight of mental health and how important it is to keep an eye on it and do something with it and about it. So just thinking about this then, Mel. We're going through a crisis, and we've talked extensively about the impact that the crisis is having on people. But let's talk about looking after our mental health. Why is it important at the moment, and how can you look after it?
That's a great question, Cash. I don't think, this might sound controversial, I don't think mental health issues are any less important or more important than they ever were. I think what the difference is maybe is at the moment is a lot more people experiencing what a lot of people have experienced for a long time. Financial insecurity, isolation, the threat of redundancy for lots of people, lack of support, loneliness, child support issues, death, dying. I think the issues aren't new. The issues are new to a lot of people, Cash. I'll give you an example. I've been running a free counselling service in the northeast, in the region, and one of my clients at the start of the lockdown, they've asked permission to, obviously not disclose the name, but disclose some history of depression, lots of underlying health problems, heart issues, diabetes. She lives alone. She's been registered blind since she was born. And when I did some telephone counselling with her, what she was facing now is not much different to what she's been facing for the last 50 years of her life. And one of the things we concluded was that she was going to start writing a journal about her life history and her experiences, not just from a therapeutic point of view, but from a point of view of helping other people. And what she's now acting, which is incredible, she's acting as an agony aunt on Facebook, helping other people not saying this is what you need to do, but sharing her immense and incredible coping strategies. And essentially, she's a first responder, and her some meaning in life and what she is now. But there are no new issues, Cash. But for lots of people, the coping strategies they need to develop at the moment are new to them. So if there is anything good to come out of this horrendous situation we're in, is the organisations and the media are beginning to talk about mental health and well-being. It's on the agenda because it's affecting so many people. And I think that we've got to recognise that people have just done nothing wrong. And we have to show some compassion and support for people, Cash, yeah?
Yeah, I think people make sense of it as they will, and I think that's where support comes in, and especially if you are a manager in an organisation. I'm guessing you're in a very different role now. You're not just a manager of a person. You might be, for example, like a first responder. But I think before I ask the next question, I'm wondering whether I could ask a question of colleagues that are on the session today. And you do this in your own time as Mel and I are having this conversation, but I'd really be interested in what has helped you the most in managing your own mental health during this crisis. And actually, for us, it's understanding what's made the biggest difference for you. Actually, that would be really helpful. And if I may share my experience, because again, you're dealing with a crisis, you're dealing with like different things clashing at home. I think what's really helped, and again, some of this is bleed through from the earlier session. It's about actually having compassion at work, having an understanding at work, and actually doing what you can, working when you can, doing the best that you can under the circumstances has been really, really helpful in terms of helping us get, to a semblance of constructive work. So I'd really appreciate if we would get some examples of what's kept people sane and helped them. And just looking at just Mel before we go on to the next bit. I've got a question from Andrew. Andrew, I'll bring you in if that's okay. You can ask the question.
Hello, yeah, thanks for that. Sorry, I wasn't sure if you wanted us to feed back. It wasn't a question, it was just to say I had something to share about what's kept me well, that's all. But if it's better written.
I think written, please, Andrew, that'd be fantastic. Just that then we've captured it then as well. I think
yeah, I understand. Okay, thank you.
Thank you, Andrew. So Mel, trying to get to the next bit of this. So let's say you're a manager, and a lot of us on the conversation today are managers, and you do a check-in meeting with one of your staff, and you ask them the question. So how are you doing today? And they say something along the lines of, well, I'm actually not okay, and they say something along the lines of, well, I'm actually feeling a bit stressed. I'm feeling a bit anxious. What do you say to them, Mel?
An excellent question. It's not easy. I think one of the things, Cash, we ask people, I think it's maybe it's British ritualistic greeting, are you okay? And all we want people to say, generally, it's not everybody, by the way, we want people to say I'm fine, which is an acronym for fed up, insecure, neurotic and emotional, yeah? I think if somebody feels fantastic, I think we'll probably ring a psychologist and get them sectioned, yeah? So I think sometimes we just want people to be indifferent. But I think the first question isn't the question. The second question is the important one. What comes after, as you quite rightly say, when you say to somebody, how are you? And they say, actually, I'm not okay. I think we gulp, and we think, I wish I hadn't asked that question. Just take a little step back in that question. One of the things I always find amazing, I've been in this business for about 35 years now. And when I've run training courses or coached people or done one-to-one work with people, one of the questions I've always asked people, I've done some kind of straw poll over the last 35 years, how many managers have been trained in basic counselling skills? And my experience is it's probably as low as 5%. And one of the questions I always ask is that, would you be let loose on a balance sheet if you weren't a qualified accountant? Or would you be let loose on whatever if you didn't have your occupational skills? So why do we let people loose on people skills? And I think some of our qualifications, an MBA, the IPD, seem to spend so little time looking at those things that take time up in the workplace, those questions. The work doesn't take time up, it's those kinds of questions. I think the first real important thing, Cash, is to learn the art of silence. To learn how to listen, shut up and listen. And the second most important is to stop thinking that you have to find a solution for that person. It really is important. I think it's egotistic, it's arrogant to think that you have somebody else's solutions. So I think the first and foremost is know your limitations, listen. I'll talk about it in more details when we have a look at maybe some of the skills, Cash, yeah? But I think the important philosophy is to listen to the person. I think the really important thing, if somebody asks a question, somebody says, well, I feel stressed. What does that word mean? I think we need to learn how to interrogate words, not people, words. So when somebody says, I'm feeling stressed, I'm feeling anxious, I'm feeling, without context, it doesn't mean anything, Cash. We need to say, when you're feeling stressed, what does that mean? And I think there's a simple format. I use this concept of cause, effect, control measure. What's causing you to feel stressed? What's causing your anxiety? How is it affecting you? And what kind of control measures do we need to put in place to help you minimize the cause and the effect? But I think if you think about it in that kind of way, it gives you structure. But I think there's two parts. One is the questioning technique and the ability for the philosophy, and one is the practice, Cash. Yeah? I don't know what answers your question, Cash.
Well, I'm listening to you there, Mel, and I'm also looking at all the amazing examples that people are sharing of what keeps them well, and actually, I think one of the themes that I think is coming out is having a set routine, and actually being able to, you know, fulfill that routine on a daily basis. So I think there's something about control in there. It's about having a semblance of control of some aspects of your day, but then, you know, in terms of if you don't have control, or if something is causing you not to have control, then the effect of that will be, you know, stress, anxiety, things like that. And actually, is there anything that you can talk to me about around anxiety and depression, and how do we even recognize it? Because actually one of the challenges that we're having during this time is that we're all this is the interface, isn't it? So you're seeing me, you're seeing a bit of background, you're seeing just what you're seeing here. How do you actually recognize some of that and doing that from afar? Have you got any tips for us on that?
Really good point. I think what we've got to forget is that there's one fix for everybody. Yeah, it's mental health is incredibly wide subject area. And just taking just three examples, you use three words: stress, anxiety, and depression, which get intertwined and in danger of becoming nothing. I mean, for people who are on the webinar, the people know the difference between, for instance, anxiety and depression. In many ways, anxiety is the fear of the future. Depression is essentially a fear of the past. So when somebody, again, stress is a great danger of becoming a word that means nothing. Somebody says, I feel stressed. And I think it's important, if you have a member of staff who says, I'm feeling stressed, from an economic point of view and from a humanistic point of view, we sit down with that person, Cash, and we say, when you're feeling stressed, what does that mean? You know, what does the word stress mean? It could be something as simple as time management. It doesn't have to be a mental health. It's causing stress, it's causing mental health issues, it's causing the person the inability to actually function productively. But it could be something as simple, not simple, it's not simple, something that somebody can't organize the day, like we've said, doesn't have a routine, doesn't have a structure. It could be something, the person could be suffering from a personality disorder. And I think it's really important that we actually recognize for first responders, including managers, we don't expect them to be psychiatrists, psychologists. And I think it's really important to know your limitations and to be able to say to that person, I'm not the best person to help you, but I maybe know who somebody can. Yeah, being able to refer somebody on to somebody else to get the support and help they need, rather than delving in situations that they're probably doing more damage to. And so I think we need to actually be very thorough in terms of how we interrogate a word. And I think that process of cause-effect control measure will help people. And I think it's really important we do not do that kind of risk assessment on somebody. We do it with them, in conjunction with them. Yeah.
Andrew, you wanna say something? I'm just looking at you. Just raised your hand.
Yeah. Excuse me. I did that time. Thank you. I just wanted to add or ask, in referring to time management, on a personal level, that caused me a lot of stress. I'm dyslexic and dyspraxic, but I often feel like I'm measured against someone who isn't.
Yeah.
In terms of the understanding, and that gives me a lot of stress in my life, and it makes me question every day whether I should just, keep battling on, or whether I should just accept that, there's a limitation on kind of jobs that I can do and stuff. But I've studied a PhD level. I'm not, I don't lack intelligence. I just lack kind of certain skills, and I don't know how to describe it. But what would you say to that, Mel?
I think one of the things, so it goes back to Andrew about being able to share, despite what you called limitations, you have been able to actually study to PhD level. Those kinds of coping strategies and skills that you have developed are necessary for other people who are similar kinds of, we can share those kinds. How have you done it? That's what I'm fascinated with, Andrew. How have you, I won't say the word overcome because it sounds patronizing, but despite whatever people have, you can overcome those adversities. But those coping strategies, other people don't have, Andrew. We need to share them with people. How do you do it? How have you done it?
I think it was just sheer determination, really. I got a first-class degree and with no support for dyslexia. I just did 12, 14 hours a day, 7 days a week, and during the holidays, I studied the next year's notes coming up, to be ahead. And for the PhD, I was in the fourth year before I was assessed as dyslexic, but I'd fallen so far behind that eventually I just had to let it go, unfortunately. And that was also a total lack by my supervisor of knowledge of dyslexia, even though it was clearly written in my support plan.
And therefore,
I think, Andrew, that leads us. I mean, that's a really good segue into the next piece, which is about actually building up what Mel's already described. In that when you're working with a member of staff, it's very much the needs are very individual. But I think what I'd like to spend a little bit of time on, Mel, if I may, and it does answer some of what Andrew you've raised. It's about so if you're a manager or you're a you described a supervisor earlier, what are the effectively they're first responders in many ways, because we certainly in our organisation at Northwest Employers, we have weekly check-ins with people just to see how they're doing, and we fully expect them to be completely different from the last time we spoke, or we plan for that. People are where they are, But Mel, can you just tell us about what we already talked about, listening skills, but to be really good at this, or to be as effective as you can be as a manager, what your thoughts about the skills that are needed?
We talked about the first one there, Cash, was the ability to listen, like you've said. The second one is the ability to not feel you have to have the solution. Will be solution focused, by the way. To have some framework on which to base your practice. We all have frameworks, whatever we do in life. And in some ways, is to know our limitations. But given Andrew's example there, sometimes we need to triage people. All we're trying to do sometimes is help the person find a way and support mechanisms. And I'm sure, Andrew, if you'd had support, even if your supervisor didn't necessarily have the skills to help you, yeah, that's not an excuse to me. He should have developed that, yeah? He should look for support. What can support him? Because I'm sure if he's come across one person, like he's come across many other people. Yeah? Ignorance to me is never acceptable, yeah? And that to me should have set him off on a journey. I need to know more about this. Or if he couldn't provide the support because of time commitments, you should have referred or found somebody who can help you get that support, yeah? So with first responders, we don't expect them to actually have all of the skills necessary, yeah? I think there's so many other skills. Questioning skills are crucial. Questioning skills that help the person solve their own problem. That to me is crucial. Certainly in psychotherapy, which I work in with my clients, I'm interested in what the person has to say and what we call presenting problems. But what I want them is never to become dependent upon me. I want them to develop coping strategies so they don't have to come back to counselling. Strength-based questioning I talk about, which is about giving people hope with the questions, which is about despite adversity, people who have depression, for instance, despite having incredible difficulties, you've got up this morning, you've come to work, you've got yourself dressed, you're functioning. How do you do that? Those kinds of strength-based questionings give people hope and help them realise they aren't as defective as the rest of the world is saying we are. And there's so many other problem solving, not solving problems, problem solving, it's a different skill. Problem solving is getting the person to come up with their own solutions, which is about trusting people that people can find their own solutions if they're given the right environment. Empathy goes without saying. Empathy is different to identification. How often when people have a problem, do we say, I know exactly what you mean, and then tell them what they should say? That's not empathy, that's identification. I believe all of these skills, focusing, summarising, attending, even skills like closure, knowing when the person needs to start to make decisions themselves and is able. I have a client at the moment, and I had to say to him last week, getting to the point where you need to start moving on. I'm not a great believer in long-term therapy. I think it becomes a process where the counsellor becomes dependent on the actual individual. I think it's about brief therapy, brief interventions to help the person make their own decisions, Cash, yeah? And all of these skills, I believe, can be learned. I started off from a blank sheet. One of the things I realised when I did my counselling psychology degree, I was an appalling listener, absolutely awful. So there's some of the skills I think that we all need, and they're not just humanistic skills, the economic skills, the skills that keep the people in the workplace, help them function and add value to the organisation. So it's not just from a humanistic point of view, it's an economic perspective.
Thanks, Mel. And I'm just again looking at the meeting, the chat, and there's quite a lot of really good examples there. And I just want to say a huge thank you to people for contributing to the chat. And yes, the slides are absolutely going to be sent out. There is something, again, a lot of what we're describing is really sort of is focused on supporting people in the workplace and trying to get almost help people find their own solutions to things. And another word that we use, well, we use a couple of words for this this concept. One is strengths-based conversations, so working with what works and helping people take accountability and action for things that they can control. And then another technique that I've certainly used as a facilitator, and I know there's a whole list of people on today who are facilitators. I use a method which is a thing called Time to Think by Nancy Klein. And it's really interesting, giving people a question and asking them to think about a question. And usually we do the exercise in pairs, and we ask the pairs to think about this question, and one person listens for 3 minutes and they're not allowed to say a single thing. And that is singly the most difficult thing that person's ever done, because we always listen to respond, we don't listen to really hear. And it took me off to another, in terms of listening to you there, Mel, about actually you listen with compassion, you listen with fascination, you try and put yourself in that person's shoes to find the best ways to help them. And I think that is a skill that often gets overlooked, and we don't exercise that muscle very often.
I think, Cash, it's summarised by a very famous saying: some people listen, most people are just waiting their chance to speak.
Yeah, and actually, we're talking about listening. I think, again, Lou, I'm just looking at your comment there about the YouTube clip about from Brené Brown. I mean, Brené's got a new podcast available at the moment as well. So I think for those of you that are fans of her, I think it's worth a listen, because actually she talks about being able to deal with some of your own demons, and actually it's a really, I think as a support package, it's fantastic. So I think we're ready to Mel, move on to the next piece, if that's okay with you.
Absolutely.
Okay, so what I want to do now is talk about and I know there's several organizations in the meeting right now who have really got their heads around this, and this is to support and bolster what you're doing, but I want to invite Sue and Lou, if that's okay, to just talk about what organizations can actually do about managing this. Now, Sue, I've known Sue since I worked in the NHS in mental health, and I think we've done some work with Sue previously in introducing this particular frame. But I'll give it over to you, Sue, to talk us through what organisations can do to help manage some of this.
Yeah, thank you very much. Well, thanks, Mel. There's so much of what you've covered that's absolutely implicit and explicit in the way that us at Health and Wellbeing Inspiration work. And actually, just a couple of reflections. I was really moved actually by Andrew's contribution there. I think there's so much that goes under the wire that doesn't get paid attention to, and there's so many messages within what Mel said about equipping managers and others to have the right skill set to be able to support people's health and well-being in the workplace are absolutely critical. So I think what the tool that I'm going to talk to you about now will help to do is maybe sort of, if you like, elevate it up in terms of what can we do at an organisational level, because all of the aspects that Mel's covered already are absolutely critical. And what I have to say is I've really appreciated Mel's honesty about early on his listening skills weren't great, because I'm not perfect either. I don't always get it right. So I think we're all in this space together, and I think maybe the current circumstances have helped us all be a little bit more compassionate and understanding and appreciative and patient as well on occasions. So I'm just going to spend a little bit of time just talking about the tool that Cash has referred to. I've got some insights into what I think could be helpful for organisations right now. But I go back to what Mel said, which is I'm not arrogant enough to think that I know the answers. I think what myself and other colleagues would do is say, we have something here that we can have a conversation with you about, because you have your own unique insights and perspective, and that's absolutely critical. So So there's probably three bits to what I'm going to describe now. So there's a bit about the tool itself, and I'll give a bit of context to that. Then there's the sort of 5 things I think maybe we could all reflect on. And then there's a couple of things about some go-to places, not exhaustive, but could be quite useful to you. And also an invitation about possibly being involved in some thought or thought leadership stuff, or thinking around, well, what are the leadership behaviours that actually help to enable healthy workplaces, because we've been commissioned to do some work in that, and I want to get a broad perspective from across the public sector to get an understanding about what people's experiences have been. So I'll probably finish with that point, if that's okay.
That's fine, yeah.
So if I go to so what can organisations do? So myself and Claire Harris and Lou Harris have done some work in Manchester. It was back in 2017, but we've all got experience in working with health and wellbeing aspects over the last, well, I won't tell you how long I've been about now, but needless to say, when Mel said 35 years, I was sitting there going, oh, actually, no, I've been around for 38. It's some sort of role that is connected to health and wellbeing in the healthcare and care sector. So I'm a clinician by background, got a real passion around health and wellbeing. I've been out of the clinical field for some considerable time now, work with teams and organisations, as do the rest of the health and wellbeing inspiration team. But we were commissioned back in 2017 to take a transparent look across the Manchester health and social care system, take a transparent look at what are the things that organisations are doing now to support health and wellbeing in the workplace. So that was our starting point. And we engaged a whole raft of organisations in Manchester. It was going through significant change at the time, but those organisations were absolutely clear that health and wellbeing, an employee in health and wellbeing, was absolutely crucial moving forward for all the reasons that Mel had highlighted earlier in his presentation or responses to Cash's questions. So one of the outputs of that piece of work, which took 9 months to complete, was that we developed a health and wellbeing framework, a baseline assessment tool at an organisational level. And in effect, what we've offered out to the whole system is this tool on a free basis. And what it enables you to do is to look at your organisation through a strategic lens to understand 5 distinct domains. And they probably make quite a lot of sense to you. So if I go through each of those, we've got domain 1, which is looking at good health for all, which is really about all the structures, processes and services that you need to have in place to promote good workplace health and wellbeing. Mm-hmm. In the second domain, we look at leadership, and that's really about how leaders and managers demonstrate and support health and wellbeing by the way that they role model and how they support individuals and teams within the organisation. And again, I think that speaks to what Mel was saying earlier about actually often we don't spend sufficient time skilling people up to have a focus of what is it you really need to do to enable and manage and support people really effectively, because I think job roles seem to become bigger and bigger and tougher and more difficult to do. So there's a real emphasis around really equipping people with the right skills to be able to do the right thing within your organisation. The third domain is around culture, because what we know is that culture is, specifically about the way that we do things around here. So again, a real emphasis around what's in place in relation to learning and development. What are the health and wellbeing norms that we support within the organisation and within teams? And then getting you to think then specifically, because I think a lot of the frameworks that were available pre-2017 from the work that we did, they were quite generic in nature. And what Manchester were really interested in us focusing down on were, well, actually, what are some of the things that we need to do to really spotlight what's required around mental health, disability and long-term conditions? Because I think a lot of the frameworks that had gone before had very sort of generic standards set, and they were really keen to make sure we had a really sharp spotlight, because I guess back to what Mel was saying, you know, actually none of this stuff is new, but sometimes it can get lost in generic assessments. So that really, if you like, encouraged us with organisations to shine a light on that. So they're the sort of 4 domains that we have developed based on good practice, taking into account the evidence base and understanding what it is and the factors that need to be in place for organisations to really hone in on what do we need to do to promote health and wellbeing in the workplace. So if I can just move on from that. So the exam, just back one, Pat, if you don't mind. So the exam question was from Pat. Sorry, back one. You need to go forward one. It seems to skip it for some reason, Pat. Lovely, thank you. So when Cash got in contact with me along with Pat, he said, well, I'd really like you to think about at an organisational level what it is that organisations can do right now. And myself and Mel had a very brief conversation with this, and I think we're pretty much aligned in that respect. And again, as I say, you know, I'm not arrogant enough to say these are the right things, but I think these are some of the probably the things to think about when you're thinking about your health and wellbeing, even in this COVID period. So there's 2 at an organisational level, 2 at a team level, and 1 at an individual level. So I would say, wouldn't I, of course, to undertake a health and wellbeing baseline assessment to understand where you are now, where are the gaps, and what your priorities are. And there's lots of tools out there, but I think one of the things about the tool we've got is it's, you know, if you like, it's fairly, it's not too orientated to one sector. So it's quite generic in nature, and I think people really appreciate that. And the value of doing that and starting those conversations is that what we experience is lots of times organisations have lots of really good stuff going on, but it's not pulled together in a cohesive whole. And sometimes what they don't always build in is evaluation processes at the front end to really understand what has significant impact. So what we believe is by using the tool helps you to sift out what you've got in place working really well and where else you might need to focus your attention over the coming weeks and months and beyond that point. What I will declare now is that our tool isn't, if you like, hasn't got a COVID lens on it. That said, I don't think that's necessary. I think you just use the tool in a way and apply that principle. So this is what we used to do in the past. Now you have COVID or anything else in the future that comes up. How do we need to look at that particular dimension so that we, if you like, future-proof it? Then at the next organisational level aspect, I think can be quite helpful. Is really about getting a snapshot, and I'm really mindful that all of you will have tools, approaches, questionnaires, all sorts of things in place already to gather information and intelligence from your workforce about how they're feeling, what's important to them. You've got staff surveys and all sorts. That said, we had a conversation recently with a colleague who works in the Ministry of Defence, and they've done some extensive work. And what they're using and finding really useful is a particular tool from What Works Wellbeing, which has a number of questions which are evidence-based, so that you can then use those questions to get a bit more of an insight from the workforce about how they're feeling, what do they enjoy about their job, are there things that can be improved, etc. So again, you may make a decision about, well, do we do it globally or do we do it with one section of the organisation? I think that's a choice for you. What they absolutely do say, though, is often when we do these big global things, what we can sometimes miss out when we aggregate things up is the local variation. So there was an absolute sort of caveat with all of this stuff. If you're going to do work like this, be clear about what it is that you're trying to achieve, and not forget that actually there will be local variation amongst particular sections of your organisation. Then at a team level, I think actually Mel's covered it. I think all the things he's talked about already, absolutely critical. as I said earlier, I think my reflection is often there isn't enough time, as Mel said, spent on those, in inverted commas, softer skills. But I think those soft skills are the hard skills, in my view. And it's really important that we all become better at learning from what we're doing and how we do it. And then in relation to the next one around the team level, I think there is definitely something about helping people improve their own job quality. Because as I was hinting at earlier, my experience often is that people come into a role and it just grows and grows and grows, and actually the design becomes a bit frayed at the edges. And I think there's some real work to do in helping individuals and within teams really look at, are our jobs designed in a way that actually help us, so we're playing to our strengths, reduce some of the stress around some of the things that maybe we find difficult to do, and are we working together to collectively to get the best out of our team and our performance. So thinking about job design, objectives, team requirements, environment and expectations. And within that,
just to sort of jump in on that one there, Sue, I think focusing on the crisis as it is today, and learning from the conversation we've just had before this with the OD network, one of the things that was mentioned was actually giving staff the permission to work when they can. Yes. And actually being able to tailor the work to the situation at home. So everybody's going to have a very, very different situation at home. Some, you know, caring responsibilities, parents with young children at school, you know, people might be on their own. And I think that there's an important conversation that I think most of us are having, but it's being able to say to people that, you know, remote working will be incredibly challenging for some people, and actually acknowledging that, and also productivity for those of us that, you know, are uber productive. You know, I think there's an acceptance that we might not be, and actually we might be utilizing our energy in other areas, like for example supporting homeschooling or looking after a loved one, or, you know, being a volunteer, for example. It depends on individual situations and how you give yourself permission to have that conversation. But it does, you're right, it absolutely comes from the organizational level down. So actually you're okay to have these conversations. So I hope that was a useful addition.
Yeah, absolutely. I think just reflecting on how quickly things move for people, and there's some good stuff around that. But actually, I reflect on, you know, my first experience of working from home on a more regular basis was probably about 15 years ago, and I hated it. I absolutely hated it. And actually, I've learned strategies, and going back to maybe the conversation that Mel and Andrew were having about what are the coping strategies I learned over a period of time. Well, a lot of people didn't have the opportunity to even think about what their coping strategies were going to be. And like you say, you know, you can find yourself in a situation where you're doing homeschooling, you've got maybe colleagues shielding, all sorts of dynamics going on, and we're all going to be in different places around that, and how we function and how we still feel a sense of purposefulness is really, really quite important. So I think, again, you know, just helping individuals to think about, well, what are your objectives? How are you going to work in the way that you need to work to be able to do that, and we won't get it right. So I think that, you know, again, coming back to, we're all learning this stuff together, and some of us have more experience than others, and having time to share those experiences is really important. And if I could just sort of finish off on the final point around this, I think, you know, again, Mel's point's really well made about how do you know, skill the individual, but skill a team in thinking about their well-being. It's so important. And we talk about problem solving together. I mean, I can think back in my career that, you know, there was always this sort of sense of, yes, we're in a team, but you have to sort it out yourself, because, you know, you're a bit nervous about saying, well, I can't, or I don't know how to work that out. But I think this is an opportunity to reflect on, we absolutely need to tap into each other's knowledge and experience, because no one person will have the answer, and that's where teams have big effect. But actually teams can really help well-being, and thinking about how you work in different team constructs. I mean, my goodness, it's just mind-boggling at the moment, the way that people are having to work and flex, and that's where some of the challenges that Mel was describing really start to surface. And I suppose there's so much out there about what you can do for yourself individually. So, getting exercise, mindfulness, sleep, all of those things. But actually just forming a habit around attending to your own health and well-being is really important. I use one of these phrases at the moment, which is very common, probably people feel a bit, now it's a bit cliche, but you put your own life jacket on first.
Yeah.
Sometimes before you can help somebody else, and think about, if I'm not attending to my own health and well-being, it's going to be more difficult for me to attend to others, particularly if I'm a leader or a manager or a team member. So again, being compassionate to yourself and understanding what you need. And just a little anecdote on that. So one of the key things is around mindfulness. I find that really difficult. So I know it's good. I know it will make a real difference. So you also have to watch out for the, beating people up with these are the things you need to do to keep yourself healthy. Because actually, if I really struggle to do that, then I can turn that back on myself and go, well, I'm not doing the best I can do then. So again, even with the advice that's out there, sometimes some of that you need to practice with it, and some things will work for you and some things they won't, but actually just sharing that can be helpful. So I'm just going to move on, if that's okay, to the next one. And I suppose what I'm really trying to highlight for people is that you have your own unique experiences and insights and perspectives in relation to the impact of this for you, for your team and for the organisation. I think there is an opportunity to take stock and think about, well, what do we need to do organisationally? And there's tools out there to help you to do that. Health and Wellbeing Inspiration Tool is one of those. And just to highlight why actually, some people will say, well, this is not a good time to do stuff like that. But if I can just reflect on some work we've been doing in East Cheshire, we were commissioned to actually use the tool with an organisation. And just as we were about to report, the report had been done, it was in draft, COVID hit. So it all just came to a slam stop. So they'd done their baseline assessment. And then when we got back in touch with them last week, we said, oh gosh, your lives will have absolutely moved on. And they said, yes. However, what's been brilliant is because we've done that baseline assessment, things have shifted, but we've got something to go back to and say, that's where we were. We have moved some things on, and actually it's helped us to refine our priorities. So again, I think it sometimes it is about timing, but it can often be easy to put these things off because it feels difficult. And I'd really urge you to use something to assess where you are as an organisation. So at least then you can begin to think about what's really important as you move forward. And just to highlight 3 resource links that could be useful to you. So there's the What Works Well website, which was commissioned by Public Health England. And I have to say the resources on there are absolutely phenomenal. They're evidence-based, great. There's our assessment tool, and of course there are others out there, so it's not just ours, there are others there, and you may have your own. And then there's mental health first aid resources, which I think again are phenomenal, and I think Mel's going to talk a little bit more about those. And then just the final point for me, if you could just move on one more slide, is to, just back one, is to say that we're being commissioned to do some work which is looking at leadership behaviours through the lens of health and wellbeing, and that's in health and care organisations. We haven't started yet, and what we'd really like to do is for people to get involved. And some of you will be happy with social media, some of you won't be. We're all different, aren't we? But actually, if you've got a view about what behaviours you think have been really helpful to promote health and wellbeing during this crisis, but actually what you think we need to keep moving forward, we'd be really interested to understand and know what that is. So there's an opportunity to get in touch with us and get involved, and really will welcome that. And also, if you think, oh God, well, I do want to, but I'm not going to, it's likely that I'll forget to come back to it, just make a note in chat. And I think the other thing is that Pat's very kindly said that she'll share slides with people. So we've got a slightly extended slide deck in relation to this, a bit more information in, and I'll send that to Pat and she can circulate those. And just to say, it comes from a position of interest. We're not going to bombard you with a whole load of marketing materials, because we don't, as a group, we don't tend to work like that. We want to understand what's of value and interest to you and your insights, as opposed to I'm sure you're all getting quite a lot of stuff at the moment. We don't want to add to that burden.
Thank you, Sue. And I think just to sort of recap, there's a lot of support available out there. There are, the links and the tools that you've shared are amazing. So thank you for sharing those tools with us. And I think what I want you to appreciate, the folks that are on this call, is that we're working with Mel to add support where we can, and we're very mindful that there's a lot out there at the moment, and what we're looking at providing you with is something that is specifically for the sector, and using some of Mel's background and expertise and building on what we've talked about today. So what we've been able to do is adapt. And adapt is a word that gets used a lot at the moment. We've had to do this in a very, very quick time frame, but I think we have come up with a series of support workshops that will be able to help your managers be really, really good first responders to some of this. So there's 4 workshops there, and the dates are as they are. So if you're interested in talking to us about that, and actually the 4 dates that we're looking at are for regional workshops, so a very similar platform to what we're experiencing today, but there is still the option for those of you that want to modify something to bolster some of the great in-house work that you're doing. So your virtual meetings and your well-being support packages that are already in place. So that's something that the team and I are very, very interested in supporting you with. I just want to see if we've got, like, we're at 12:29. Typically we've got a minute for any sort of final comments and questions, which again I would encourage you to use the chat box as you have been. But I think if there is anything that anybody would like to share with us in closing, then I can probably take one question, and if there isn't any, that's fine. We can close. And just wanted to say a huge thanks to Mel for you and your sort of time and expertise in creating the package with us. And also I just want to say a huge thank you to Sue and the team from Health and Wellbeing Inspiration. As ever, things happen at a pace, don't they? And I just want to say thank you from Northwest Employers for working with us and being at the session today and sharing some of your fantastic wisdom. So thank you, everybody. I have got a question, which it's from Andrew. Do you want to unmute Andrew, and we can answer the question?
Yes, thanks. I'll keep it brief. I just wanted to say it's important that we get the message. I think it's great what you're doing, and what we heard today. It's important to get this across the UK and beyond if we can. The most frustrating thing for somebody with my differences is to move into a new community, a new workplace, etc., a new relationship, and then have to begin the whole process again of being understood, because the ignorance is so widespread, and ignorance is not necessarily always deliberate, but so knowledge is so important.
Thank you for that, Andrew, and yeah, completely agree. It's about how we can build awareness and help our colleagues, be and do the right thing for our staff and our people. So I completely agree. And yeah, I can see lots of people are leaving the session. That's absolutely fine. I just want to say in closing, thank you again for your time. And if you are interested in any of what we have described, please get in touch with us. And I look forward to seeing and speaking to you all again very soon. Thank you, everyone.
Thank you very much. Bye-bye.
Bye.